one is left untouched by the miracle of childbirth. But having a baby broke my vagina. How could this be? I had an OBGYN with the best pedigree in bedside manner. I'd commissioned an RN as a doula, not one of those ladies with a headscarf and a drum. I had a 10-page birth plan with every possible outcome detailed based on the classes I had taken and books I had read. I was a healthy 29-year-old woman, and most importantly, I had a very loud and supportive partner. As my contractions sped, so did my excitement. I called my doula. She instructed me to take a nice long bath. With pruny fingers, I called her back from the tub, and she asked me if I thought my baby would wait until the following day to make his debut. She had plans. I told my husband I would like to go to the hospital. He asked me how his shirt looked. You only get one chance to make a first impression. After trying on a few more shirts, he found the exact right outfit. I hoisted myself out of the tub and we headed to the hospital. Entering the ER, we were informed my OBGYN had left for the day. No worries, I had my bullhorn of a man and perfectly crafted birth plan in my hip pocket. I handed the new doc the document. She tilted her head to the side and offered me an amused smile. The contractions weren't close enough for the doctor to stay, so I decided to try some of the techniques the doula had taught me. I got down on all fours and assumed various other primal positions unbecoming of any lady, especially a pregnant one. I sat backwards on the toilet as my husband softly punched my butt. I think sitting on the toilet was supposed to relax the muscles down Petticoat Lane. Don't ask me about the butt punches. After several hours, my water had not broken, and I still felt like I was being repeatedly stabbed in the stomach. I requested an epidural, which was planned. There is no badge of honor for suffering. The doctor recommended I take Pitocin. I reluctantly accepted. Where had that birth plan gone anyway? The baby's heart rate was dropping. The nurses brought in a mirror so I could watch myself push and see the baby for motivation. When I began to defecate, the mirror was quickly rolled away. I did not know this, so I didn't think that I evacuated my bowels during labor. I even bragged about it months later at a dinner party. But my husband told our friends, "That's not true. Tiana pooped twice." The doctor spent an hour and a half sewing me up. The episiotomy had resulted in extra tearing, but she assured my husband I would be good as new in 6 weeks. Likely even better, which could be fun. She had given me the husband stitch, an extra stitch that makes the vagina and tighter than before birth. I wasn't asked if this is what I wanted, but my baby's head was in the 98th percentile, so the stitch seemed necessary to prevent urination through my rectum. Becoming parents was wonderful. Every moment was about Frederick, but after a few months, we were ready to reunite as a couple. I went to the OBGYN for my follow-up appointment to see how I had healed. The doctor was unable to insert the speculum, but had cleared us for intimacy anyway. The first attempt was like putting a cat in a bathtub. We couldn't get it in all the way, and no one left happy. It had been a while, but surely we remembered how babies were made. We'd just made one after all. After a few more months, we tried again, but nothing could be planted at Flagpole Hill. I went back to see the first available OBGYN in the practice. This doc couldn't get the speculum to work either, but used more force. When I screamed, she said, "You pushed an 8-pound baby out of there? There's no reason for you to act this way about an exam." My doctor also told me that the best way to fix my broken genitals would be to have another baby. And they could try to sew me up differently next time. I was afraid sex post-childbirth would be like throwing a hot dog down a hallway. This was more like trying to force a hot dog through a straw. I talked to a dear friend who shared with me that her pelvic floor issues after childbirth had been greatly helped by a physical therapist. For 3 times a week for several more months, I saw a physical therapist to stretch my vagina. It helped some, but not enough for a home run in the bedroom. And at this point, it had been a year since our baby was born. In addition to the opening being unaccommodating, I was told I had vaginismus. If you don't know what vaginismus is, your medical professional can provide you with a video made in 1978 featuring 2 adult stars. A young lady with a small frame expanding her snatch using a series of inanimate objects which increase in size, and a slightly older man with an athletic build who's the reason for the saying, "hung like a horse." If I didn't have vaginismus before, I certainly did after watching that movie. My husband said the film also caused him to have vaginismus. Yeah. Friends and family were asking when we planned to have another baby. I didn't know how to tell them that I was out of commission, that I wasn't depressed but fearful. I had experienced so much pain and seen so much blood, I was as traumatized as a war veteran. And I had a Barbie doll's vagina. When I tried to, they still asked where my second baby was, confirming my fear. We are living out a dystopian future envisioned by Margaret Atwood in A Handmaid's Tale. How much is sex worth to you? I asked my husband as we reviewed our bank account statement, haggled with insurance companies, and had many uncomfortable chats filled with what-ifs. I offered to budget for an escort service for him. I preferred the idea of a service because of the level of professionalism and control over the exchange. I still wanted to be married to him, even if we couldn't act on it fully, and recalled from Pretty Woman about the rules restricting mouth kissing. He declined and said he would rather live without sex than ever bed another woman. Not wanting my husband to feel stuck with me, or a sexless marriage in my 30s, the time women are told they will have mind-blowing, multi-orgasmic, hair-pulling sex, I went with the only remaining option, surgery. The surgeon told me there were no guarantees. My opening had been sewn up too tightly, and my perineum skin had fused together, forming a web. Sadly, having fused glutes did not make me a better swimmer. Scheduling the surgery, I had flashbacks to my time in college working with Amnesty International to end female genital mutilation. I sympathized with the victims of the practice, but I never thought I would be in a position to empathize. When the big day came, I was ready. This was it. The husband stitch that had gone awry would be remedied. The surgeon asked me what I wanted my vagina to look like. I asked for a starfish or a unicorn. And requested photographs of historically important vaginas. The surgery was successful, but I had to return to physical therapy due to scar tissue. After several more months, I was ready for a test drive. Everything looked ordinary now. You couldn't even pick my vagina out of a lineup if you tried. And after almost 2 years, we were reunited. I can't do as many tricks, but I get the job done. In spite of everything, childbirth was worth it. Frederick was worth it. He is the best thing that has ever happened to my husband and me, and I'm so glad we are stuck together.